Now we're going to hear from our first speaker, Dr. Ajumobi. Dr. Ajumobi is the Associate Professor of Medicine, University of California, Riverside, Chief of Gastroenterology, Eisenhower Health, Rancho Mirage, California. Dr. Ajumobi, please go ahead.
Thank you very much, Dr. Ogumbi, for the kind introduction. Next slide, please. Colorectal cancer is cancer that originates from the colon or the rectum. The colon is also called the large bowel or large intestine, and it connects the small intestine to the anus. The lowest part of the colon is called the rectum. Next slide, please. Colorectal cancer is the third most common cancer in the world, fourth most common cancer in the US, and fifth most common cancer in Africa. However, it is the second leading cause of cancer death in the world, as well as in the US, and the sixth leading cause of cancer death in Africa. Next slide, please. In 2022, about 106,000 people will be diagnosed with colon cancer, and about 44,000 will be diagnosed with rectal cancer. About 53,000 people will die from colorectal cancer in the US. 1 in 23 men and 1 in 25 women will be diagnosed with colorectal cancer. If all eligible individuals got their screening, about 68,000 of these deaths would be avoided. And up to 1 in 3 people are not up to date with their colorectal cancer screening. The burden of colorectal cancer is highest among Blacks. Blacks, compared to whites, are 20% more likely to get colorectal cancer and 40% more likely to die from it. Black men in particular are 24% more likely to get colorectal cancer and 47% more likely to die from it. Next slide, please. In Africa, it appears that colorectal cancer occurs at a younger age. 25% of all colorectal cancer in Africa occur in people younger than 40. Most of the cancer also appear to be right-sided, meaning the right side of the colon, as well as in the rectum. And they have certain features that make them behave differently. There was a study that was done not too long ago that compared early onset colorectal cancer in US African Americans versus Nigerians. And it showed that Nigerians they tend to be younger when they present, and they tend to have more cancer in the rectum. Next slide, please. There are so many risk factors for colorectal cancer. Some of the risk factors we can do something about, so we call them modifiable risk factors, and some of them we can't really do much about. The ones that we can't really do much about include age. The older you are, the more likely you are to have colorectal cancer. Men are more likely to have colorectal cancer compared to women. Black people, as well as Ashkenazi Jews, are more likely to have colorectal cancer. People with inflammatory bowel disease, like ulcerative colitis or Crohn's disease, are also more likely to have colon cancer. Patients or individuals with certain genetic disorders, like Lynch syndrome or familial adenomatous polyposis, are more likely to have colon cancer. And of course, if you have a personal history of colon polyp or a family history of colon polyp, then you are more likely to have colon cancer. Exposure to radiation particularly in the pelvic abdominal region, also increases one's risk for colon cancer. Now, in terms of the risk factors that you can do something about, these include alcohol, a diet that is low in fiber, diet that is low in fruits and vegetables, high-fat diet, red meat, processed food in general, tobacco, obesity, and lack of exercise. I will end my talk by saying that while we want you to change your lifestyle by eating right and exercising, the most important thing you can do to reduce your risk for colorectal cancer is to get screened. Thank you.